Welcome to this continuing series of our virtual solution series here at Washington Policy Center. My name is David Bose. I'm Communications Director for Washington Policy Center. Today, we're going to feature Dr. Roger Stark's new book. It's Healthcare Policy Simplified, Understanding a Complex Issue. Dr. Stark just recently published this book, I think about 3 weeks ago. And he has been a tremendous asset to Washington Policy Center and to the state and the nation when it comes to discussing healthcare policy. So we're going to talk to him. The way it's going to work is I'll ask him some questions for about 20 minutes to a half hour. And then we're going to take your questions. You can ask a question at any time in the question function. It's the toolbox on the right-hand side of your screen. Ask a question at any time, and we're going to assemble those questions and ask Roger those questions in the latter half of the program here. So, and then, of course, if you have a question later on, you can add it then, but don't hold back. Ask the question at any time. If you're uncomfortable with that function, with the question function, just email it to me, dbose@washingtonpolicy.org. That's D as in David, B as in boy, O, Z as in zebra, E as in egg, dbose@washingtonpolicy.org if you prefer to email me directly. And I can ask some questions based on on what I receive via email as well. I want to also remind you, for the first time ever, Washington Policy Center has our annual dinner. Both the east side and the west side is going to be combined into one statewide online event on September 25th. Now, also for the first time ever, the event is going to be free. For those of you who just want a general admission ticket and want to see what Washington Policy Center annual dinners are like, you just get your ticket registration for free online. And there are sponsorships and VIP opportunities available, but I'd like to emphasize, if you know someone who appreciates the work that Washington Policy Center has done, that appreciates free markets and entrepreneurship, and what free enterprise offers in terms of opportunities to address state policy issues, this is the time to get them on board with Washington Policy Center. And like I say, they'll hear from former Congressman and federal prosecutor Trey Gowdy as one of our keynote speakers, also acclaimed historian and best-selling author Victor Davis Hanson, who's a tremendous commentator in his own right. And so I would urge you, if you have a friend who has been holding out, isn't really familiar with Washington Policy Center, invite them over and have that small group and watch the September 25th online Washington Policy Center annual dinner together. It's going to be a great event, great show, so tune in for that. Just register online at washingtonpolicy.org. Really easy to find in the events section. There's an events tab at the top of the screen. You really can't miss it. We'll also share it on the side screen. Roger's book, as we talk about the book, if you want to buy it, maybe you want to buy it for a friend or someone you want to convince or talk to about healthcare policy, that the direct link to Amazon is going to be available in the tool section of our GoToWebinar meeting here as well. So everybody will have access to it. You'll see it right there on your screen, and you can click it and go straight to Amazon and purchase the book. Now I'd like to bring Dr. Roger Stark on to our screens. Dr. Stark is or was a heart surgeon. He's retired now. He's been involved with Washington Policy Center for a decade, and has just been a tremendous resource. When I was on the radio, I used to call on him whenever a healthcare topic came up, and he's had a tremendous career. I always say that, Dr. Stark, when you're in the room, if I just defer to the heart surgeon, that's automatically. I assume you're pretty much the most educated guy in the room, and so we should just defer to you. But welcome to the program, and it's always a pleasure to talk with you. You're looking tanned, rested, and ready, as they say.
Well, thanks very much, Dave, and thanks to all the attendees here at the WPC Solution Series this morning. Appreciate your attendance.
So why don't we start with this? You've been dealing with healthcare for for your entire career, but healthcare policy with Washington Policy Center also seems like forever to me. I mean, I've always associated you and the center as almost as one, and I feel like you've been trying to simplify healthcare policy for every single one of those years. Why come out now and say, here's the book, Healthcare Policy Simplified? Why do you think people need a manual like this right now?
I think we're at a crossroads, to tell you the truth. course, I thought that for the last 10 or 12 years, but truly right now, I believe the United States is at a crossroads as far as healthcare policy is concerned. We can either go down the road to more government control, more government intervention in our healthcare system, or we can put the responsibility, give patients more control over their own healthcare dollars, and their own healthcare decisions. So I think we truly are right now at the crux of the issue. We're at the crossroads, and like Yogi Berra used to say, when you come to a fork in the road, take it. And so what we need to do is take the right fork in the road here.
So what do you hope people will do with the book? I mean, one of the things I'd like to point out is, and you point this out in the introduction, is it's written in such a way, it's not a continuous narrative where somebody has to plod through the entire book, but they can skip to the chapter, the subject heading of their choice, and understand a component of the healthcare system. Because as you point out, all of us are interacting with the healthcare system in one way or another, but we're interacting with a small piece of that healthcare system. And the larger piece is much more complex and much more difficult to understand. So, why write it that way? What are you hoping people will do with the book, and how do you want them to use it?
Yeah, that's a really good point. I think you can read it from cover to cover, and you can get a great understanding, or you can use it as a reference and say, let's see, what do I want to know about health insurance? Or what do I want to know about the Food and Drug Administration? What do I want to know about the history of healthcare in this country? And so you can read it a chapter, you can skip around, but it can be read cover to cover and give you a great overview of our healthcare system and how we got into the situation we're in today.
So what do you think, as you were writing this and trying to simplify healthcare policy, I remember back from my college days that one of the more difficult assignments was to try to simplify a very complex idea into a small number of pages, okay? Because you really have to keep winnowing down as far as what is absolutely essential knowledge for that person. For you, who's had a broad experience in healthcare throughout your career, was there a topic or a piece of our healthcare system that was surprisingly complicated to you, that you found it most difficult to simplify?
No, not really. I mean, there are so many diverse issues with healthcare, and if you want to drill down and really make any one of them complex, you certainly can. I mean, what I mean by that is there are hundreds of healthcare policy books out there written. Some deal specifically with very narrow areas of healthcare, like Medicare, for example, or the Children's Healthcare Insurance Program, for example. So yeah, you can really drill down on pretty much anything and make it complex. And that's what I found in my career. Dealing with insurance companies, yeah, it was a problem, but at the end of the day, if you sort out what the main issues are with insurance, for example, you can simplify that and you can make it understandable for anyone who's not a medical professional, for example. So, yeah.
So I'm going to ask you about something that comes up at every healthcare debate, and I think it's been one of the top issues. It's generally, and I think wrongly, it's treated as, if you are right of center, you think that people with pre-existing conditions are out of luck and on their own. And if you're left of center, you say, we need a healthcare policy that makes no distinction about pre-existing conditions. So my question to you is, what should be done with people that have pre-existing conditions? How do we deal with that complication?
Yeah, there are ways of doing that, and you're exactly right. That is a major issue. And when you poll the American public, they say this pre-existing issue is probably one of the best features of Obamacare, or the Affordable Care Act. That's one thing that the American public can agree on. I think what you can do is you can take high cost, high utilizers of healthcare, people with extreme pre-existing conditions, and you can isolate them in their own health insurance plan. And what that would do then, that would leave every other person who doesn't have these high cost and high utilization you could form a insurance program for them. Now, how you fund that insurance plan for the high-risk individuals, we can discuss that. We can kind of get into the weeds about how that should be financed, whether that should be done socially through taxation or whether that should be done through a small premium on health insurance plans. But there are methods to deal with this pre-existing condition without including everyone in increasing the cost of healthcare and healthcare insurance.
So where do you think we're going wrong with Obamacare on that score then? I mean, or the Affordable Care Act, depending on how you want to phrase it.
Well, as I mentioned, what the Affordable Care Act does is it says, okay, everybody's in the same insurance risk pool, basically. And so everybody is paying a little bit more in insurance premium to cover all of these individuals that have high cost and high risk. Whereas if we take those individuals and we isolate them, we provide them with health insurance, but we put them in a different risk pool, then everyone else's premiums will come down, and as I say, that will decrease the cost of healthcare for the vast majority of people.
And then you can subsidize that risk pool in some other way. Is that what you're saying? Whether it's oh, go ahead.
Yeah, no, that's exactly right, Dave. Yeah, you subsidize it either with either by some sort of taxation, socialize it that way, or you add a very small increase in everyone else's insurance premiums. I mean, as it stands now, insurance companies have no way of knowing who is and who is not in that high-risk pool. And so they charge everyone like potentially everybody would be in a high-risk pool. And that's one of the reasons that we're seeing the dramatic increase in health insurance premiums in general, overall.
The second most common, I think, criticism of a right of center or a free market approach to healthcare has been the entitlement programs, Medicare and Medicaid, and there's an idea, and Social Security, but we'll just stick with Medicare and Medicaid right now. And there's this idea that if you're for free market reforms of healthcare, you're for obliterating these programs that so many people have come to depend on. What is it that people don't understand about these entitlements?
Well, basically, if we go back to when Medicaid, Medicare began in 1965, it was thought that seniors could not afford health insurance, and it was also thought that low-income individuals, non-seniors, low-income individuals, needed some sort of a safety net. So the Medicare Medicaid law was passed in 1965, and Medicaid began, like I say, as a safety net program for low-income people, and that probably is the responsibility of government. Medicare, on the other hand, there's a real question whether there was a need for this or not. Well over 60% of all seniors in 1965 had access to affordable health insurance and had affordable health insurance. And so whether we needed to put every senior into this entitlement program of Medicare, that's questionable. Now, what's happened over the last 55 years is Medicaid has become almost unrecognizable as a safety net program. It now includes able-bodied 18 to 64-year-olds. It includes a whole number of things, including transportation to see the doctor, translators, all of these kinds of things. It's almost unrecognizable. Medicare has exploded, and if we look at federal spending over the 21st century, if we look at the increase in federal spending over the 21st century, the vast majority of that, by the time we hit the mid-21st century, is going to be Medicare, Medicaid, and then throw in Obamacare as part of that as well. So these entitlements have become almost unmanageable. They need to be reformed. They absolutely need to be reformed so that future generations can have access to them if necessary, if they need them.
Toward the beginning of the year, I saw a public opinion poll. I don't know if it was public or not, but basically there were a great there was a majority of Americans that liked the idea of a single payer plan. And the impression I got based on the poll responses was, look, if government's paying for it, it's so simple. I don't have to worry about insurance, which insurance plan to pick anymore. Everything seems, free. So they like this idea of a single payer government run healthcare system. But when the follow-up questions were asked in the poll, which was if government, it takes the reins and controls healthcare policy, ultimately there will have to be a cutting of costs, and to do that they'll have to ration care. Once you inserted the idea of limits on care and limits on control, people didn't like that idea anymore. They don't like the idea of losing that control. One, why do you think there's such a disconnect when people are contemplating the idea of a single payer healthcare system? Why do you think that they have this idea that they're going to be able to maintain control and make the choices that they want, and that there would not be this kind of rationing? Why do you think that idea sticks? And then secondly, what kinds of decisions would be lost if we're at the fork in the road, as you say, in the U.S., and we've been kind of strolling along socialist lane, so to speak, and we end up just taking a sprint and headed that direction in healthcare? How does our relationship with our doctors change? How does our relationship with the healthcare system change? Two big questions.
Yeah, well, first of all, you put your finger right on it. It looks ostensibly like a very simple system. There's no insurance companies, the docs get paid, you don't have to worry about whether the doctor can see you or not, and it just seems like it makes a lot of sense, and it's a very simplified system. Now, and we spend a fair amount of time in the book discussing single payer, healthcare as a right, things of that nature. Now, the problem, of course, as we rush down that single payer system is, as you point out, is one of rationing. There's only so many dollars that we can spend on healthcare, and what we need are patients to have control of their healthcare dollars and to be able to make their own decisions in concert with their providers and provide the kind of healthcare that they want and need. If you look at countries that already have a single payer, and Canada is sort of the poster child for a single payer system, there's a number of ways you can ration healthcare, and the way that they use is with waiting lists and decreasing access. The average wait in Canada in 2019, from the time a patient saw a primary care doctor until they got specialty treatment, was 20 weeks. Now, that's 5 months, and that would not be acceptable to citizens of the United States. Those kinds of waits would just not be acceptable. So, it looks like it's a very simple system. It seems like it makes a lot of sense, but in reality, it doesn't. There are only so many dollars that can be spent.
Now, would it be fair to say that in some circumstances, if you have to wait, 5 months for, let's say 5 months for an MRI or for some certain treatments, that, your ability to stave off disaster when it comes to your own healthcare, that might be impacted? I mean, your life could be at stake because of the extended wait. Isn't that fair to say?
That's absolutely right. And there are documents and there's research done that actually show that. I think what other people need to understand is Canada really has a two-tiered system. Ostensibly, they're a single-payer system, but if you have the cash, you don't want to wait, you can simply come down across, before COVID-19, you could come down across the border and receive treatment in the United States. So really, they had a two-tiered system. And I think when COVID-19 goes away, they will continue to have a two-tiered system. If the United States went to a single-payer system, where would we go? To Canada or to Mexico? That makes absolutely no sense. So I think that's the reality of what healthcare is like in our northern neighbors there.
I want to remind people we're talking about Dr. Roger Stark's latest book, Healthcare Policy Simplified, Understanding a Complex Issue. There is a link to the book direct to Amazon right there in the chat function of your screen. If you look at your toolbox there, your GoToWebinar toolbox, there's a link direct to Amazon, so you can click it and buy the book yourself right there. Also, we've got our virtual annual dinner events, Washington Policy Center Celebration of the Free Market. That is free for general admission. You can go to washingtonpolicy.org and register for free. That's coming up at 7 p.m. on September 25th with special keynote speakers Trey Gowdy and acclaimed historian Victor David Hanson. So you hear from the great Congressman, former Congressman and prosecutor Trey Gowdy, and acclaimed historian and commentator and author Victor Davis Hanson. And so you go at washingtonpolicy.org, just look for the events tab, and then it's very easy and self-explanatory to register for that. And be sure to share it with your friends as well. Also, if you've got a question for Dr. Stark, now is the time to start typing it in. There's a question function right there in your toolbox. Just go there, ask your question, and we'll be taking your questions for Dr. Stark here in just moments. So ask any question you wish about healthcare policy, and just don't ask Dr. Stark for a free consultation. You know, did you get that a lot, Dr. Stark, from friends? Hey, could you look at this mole on my back here and just let me know how it's going?
Yeah, that was always fine. That was okay. Part of the deal.
Well, excellent, man. We should have opened it up for that.
Yeah.
So one of the challenges that I see with the understanding this healthcare system we have is it is really complicated. People are used to a third party paying for it. So when you bring up this idea that they should have control over their own healthcare dollars, you know, it's hard for people to think that way because it sounds like you're adding expenses to them. If you say, hey, you know, let's say, you know, you got to purchase your own healthcare plan, they're like, oh my gosh, that's so much more money that's going to come out of my pocket instead of having my employer pay for it, because they don't realize, you know, it's still coming out of their pocket. They just don't see it come out of their pocket. That's kind of the ingeniousness of the third party payer. But if you had to make one change, if you had to do one thing to try to stall or change the direction of the US right now at the fork that you're talking about, heading toward more government control instead of more individual freedom and more individual control over healthcare, what would that one reform be for you?
Yeah, well, you put your finger right on it, Dave. The reform would be to eliminate the third-party payer. If you consider this, whether you believe that healthcare is a right or not, we can all agree that healthcare is a necessity of life, just like food and shelter and clothing are necessities of life. And if you think about this, our employers do not pay for our food, shelter, and clothing. They give us wages, and we go out and we purchase these things on our own. It's the same thing the government doesn't provide, except as a safety net. The government doesn't provide food, shelter, and clothing for the vast majority of Americans. So to rely on government for health care actually sort of flies in the face of all these other necessities of life. Now, that would be the one biggest thing we could do is to eliminate third-party payers and allow individuals as patients to use their own healthcare dollars to purchase insurance and to pay for their healthcare. Now, that takes a number of reforms. First of all, half of all Americans receive their healthcare benefits through their employer, their spouse's employer. So we eliminate that. Well, no, it's not more money out of the employee's pocket. They would be receiving more in wages from their employers so they could go out and purchase insurance on their own. The same thing with Medicare patients. I mean, throughout our working careers, we pay into a Medicare trust fund. And if we didn't do that, if we had health savings accounts, for example, that we could take into retirement, and then a more robust, deregulated, if you will, health insurance industry, especially in the individual market, patients could go out and purchase their own health insurance using health savings accounts, high deductible plans, and things such as that. So it would take a major sort of intellectual shift on the part of Americans who are used to getting their insurance from their employer or from the government after age 65 or 64 through Medicare. And yet we could do that. We need to allow individuals then not only to find their own health insurance plans, but also to take the same kind of tax deduction that employers are now taking. That's one of the reasons this employer model has really stuck since 1943. Is they provide the benefits and then they can take a deduction off their company tax roll just straight away for those benefits. It looks like a win-win. On the other hand, employers then control what insurance plans employees can use, what kind of plans, what's involved in those plans, and so forth. Again, using a third-party payer kind of philosophy. So that's the fundamental. If we're going to really inject individual health or healthcare reform, we need to somehow eliminate that third-party payer. That's the fundamental here.
Don't we also kind of get stuck with, when you talk about diversity or competition among healthcare plans, one of the challenges is getting legislators and policymakers to understand that it's okay to have some healthcare plans that don't offer everything. Whereas, since I became politically aware sometime during my, I think, senior year of high school or something, whenever I saw a story about healthcare, there inevitably were, there was a call for new things to be added to plans, and that has not stopped throughout my life, where there's, new mandates that are placed on health insurance companies of what they must cover. And when someone says, hey, we should reduce those mandates, then they're demonized as someone who doesn't care about whatever it was that those particular treatments were supposed to supply for. So how do you deal with that issue, both from a societal point of view, from a persuasive point of view, and then also from a policy point of view?
Yeah, that's a really good point. And again, we spend at least a chapter on health insurance in the new book. When people say, I have great health insurance, what they mean is it covers everything. It covers dental, it covers eyewear. Now, think about this in relationship to automobile or homeowners insurance. Now, granted, I'm a physician, so I understand the human body is different than a car, different than your house. So don't beat me up about that. But insurance is insurance. With automobile insurance, we don't have part of the insurance cover brake jobs or putting gasoline or changing your oil. Homeowners, we don't have insurance that covers cleaning the leaves out of our gutter or mowing our lawn. We take care of those things on a day-to-day basis with cash. But we do have insurance to cover major automobile damage, major homeowner damage, things like that. So conceptually, health insurance should be looked at in that same way, where we have some mechanism to take care of day-to-day stuff like health savings accounts, and then we have major catastrophic policies to cover major hospitalization, major cancer treatment, things of that nature. So it's getting out of this mindset that health insurance is somehow different or should be different than automobile or homeowners, and it shouldn't. It should be risk mitigation, and that's it, basically.
If you have a question for Dr. Stark, just go to the question section there of your GoToWebinar toolbox, ask that question. You can also click the link to get to Dr. Stark's book directly to Amazon, where it's available. We also have the link up for the Washington Policy Center annual dinner. So that's our virtual event coming up September 25th with former Congressman Trey Gowdy and acclaimed historian Victor Davis Hanson. Tickets to that are free, donation suggested, but if you have a friend, you want to introduce to free market policy, it's a great event to start that up with, so be sure to at least copy that link and share that link with your friend. And also the link to Dr. Stark's book too, because look, a lot of questions about healthcare policy. In fact, one of the things that surprised me, Dr. Stark, before I get to the audience questions, was that healthcare, after all these years of the Affordable Care Act, so-called, or Obamacare, after all this time, that was supposed to kind of lay to rest the controversies about healthcare, and yet healthcare remains one of the top, if not the top, one or two political issues that concern people, outside of urgent events that come up in the news. This is still, healthcare policy still ranks as among the top political issues. How do you change that?
Well, I think first of all, you have to look at the two goals of the advocates and the architects of Obamacare, and that was to decrease cost of healthcare and to increase access, provide universal health insurance. Those were the two main goals of the Affordable Care Act, and they have failed miserably. not only insurance costs, but overall cost of healthcare in the last 10 years have gone up dramatically for virtually everyone, except in the Medicaid entitlement population. But even in Medicare, our seniors are paying more as far as premiums are concerned, their deductibles are going up and so forth. Certainly in the employer side, people are paying more, and in the individual market, they're paying more. Healthcare costs were about 17–18% of our gross domestic product. They're heading closer to 20% now overall for the country in general. When Obamacare was signed into law in 2010, 10 years ago, roughly 50 million Americans did not have health insurance for one reason or another. And to date, through Obamacare, through the Medicaid expansion and to the individual market in the exchanges, about 20 million people now have health insurance who did not have it before. So that 20 compared to 50 million, that's about a 40% movement towards the goal of universal health insurance. So Obamacare has been an abject failure. Now, you can say, well, gee, if we put everybody in a Medicare program, Medicare for all, single payer, like we just discussed, everybody would have health insurance. So we take care of universal access. We can ration health care and hold costs down. That's absolutely true. But the corollary there, as we alluded to earlier, is that just because you have health insurance does not mean you have timely access to health care. And that's really the critical thing, accessing health care as well as holding costs down.
So I'm going to go to audience questions now and give them an opportunity to ask you questions. I also want to tell everybody who is watching this Solution Series event for Washington Policy Center, if you have an organization and you would like to have Dr. Stark speak to it via Zoom about this book and healthcare policy, feel free to email me or email Dr. Stark directly. The information is freely there at washingtonpolicy.org. I'm dbose@washingtonpolicy.org, or Dr. Stark is rstark at washingtonpolicy.org. Let us know that you want Dr. Stark to speak to your organization about this book, about healthcare policy and its complexities and how to simplify it, and we can schedule something there as well. The first question for you, Dr. Stark, is a challenging one. The viewer writes, in talking about the Canadian system, you spoke of rationing. Can you address the fact that we have a form of rationing that exists in this country, and that rationing is a function of the coverage the individual has or doesn't have? Isn't it disingenuous to not acknowledge that we simply have a different form of rationing?
Well, I think, again, it really depends on how you define access. And I think clearly in this country, people do have access to health insurance, and they have access to emergency rooms, things of that nature, walk-in clinics. One of the big things when Obamacare was being debated was the issue of what are called free riders, people who use our healthcare system and actually don't pay. And that number is actually quite small. I haven't looked at it for a year or two, but when Obamacare was signed into law, the actual free rider issue, how many people used health care without paying, was much less than 3% of all people in this country. And so that issue, it shouldn't actually be, it's like comparing apples and oranges. If you want to say rationing in this country is real and people can access health care, I would strongly disagree with that. Whereas it's very clear in Canada that, yeah, you've got health insurance, but you do have a decrease in access simply because of these waiting times.
Next question is just a criticism of availability. Mark wants to know, why isn't there a Kindle version of this book?
We just haven't gotten around to it yet. It came out a couple of weeks ago. That's a good question, though. Yeah, in this day and age.
He's a doctor. Come on. All right. Next question. How does the country deal with the uninsured? What should we do about that?
Well, again, if you make insurance cost effective. And what I mean by that is if you don't have all of these benefit mandates in every insurance plan, like dental and like eyewear, and you tailor your insurance plan for your actual needs or your family's needs, that will hold the cost down. Now, if someone truly can't afford insurance, Washington Policy Center, we're not a libertarian think tank where you're on your own out there. There is a role for government. And truly, if people cannot afford insurance, that was the original reason that Medicaid was designed and was passed into law. And I think that still is a good is a good mechanism to take care of people who are uninsured.
Next question, what impact will price transparency have on the cost of healthcare? Will we see that in Washington State?
Yeah, I'm hopeful we'll see it in Washington State. This may be a federal kind of thing. I would just as soon see it on a state-to-state basis, and I would just as soon see no legislation. I would really like to see providers doing this on their own. That is problematic at this point in time, but I think it's what the goal should be. Now, how is that going to hold costs down? Well, think of these, like we talked about before, these other necessities of life. I mean, you shop for an automobile, for example, based on your needs and costs. You shop for food the same way, based on your needs or your family's needs and costs. It would be the same thing with healthcare. You would become a savvy consumer of healthcare and would use price transparency as one of the things to pick providers and to pick where you're going to seek out your healthcare. I've had many people say, "Well, look, Stark, you're a licensed physician. You understand healthcare. We can't do this." And yet, I submit to you that Americans are the best consumers in the world. And Americans can get this figured out. They can figure out healthcare on their own. And of course, the book simplifies this sort of thing so that you can. With the tools we have today, not only talking to your neighbors, getting second opinions, but going on the internet and reading reviews and things like that. I mean, we can pick, like I say, clothes. We can pick food. We can pick our homes, our shelters. We can pick out healthcare as well. Even the average American can do that.
It's interesting to me, when people ask that question, I think back to my time working in the state legislature. I worked with one individual, a lawmaker, who had a surgery coming up, and the first place that he called, he asked, how much for cash to get this done? And it was a fairly simple procedure, and they were kind of stunned at the question. He finally got a response. The response was somewhere around $40,000. And by the time he called around at different places to figure out where he could get it done, for less money at the same quality, he had the price down to around $8,000 or $8,500, somewhere in there. So it was just a huge difference in costs with cash. And it was because there was one place that had a day where they did these kinds of surgeries, so the expertise was all there, the setup was all there, it was ready to go. And if he could do it at this point in time on that day, then it was going to be less expensive. But that disparity in cost, the difference between nearly 40,000 versus 8,000, just tells you just how much money is just kind of sloshing around in the healthcare system. And it looks like it's just being consumed mostly by complexity, by red tape.
Well, yeah, that's part of it. And the corollary is, if somebody else is paying for it, you're not going to care. I mean, I'll be perfectly honest with you, Dave, and with the audience here. I ordered hundreds, if not thousands, of x-rays in my career. I have no idea what a chest x-ray cost in my main hospital, and that's ridiculous. It's like, okay, Charlie, you've got great insurance, don't worry about the cost. Well, that's exactly what we need to get away from. We need the price transparency so that patients can become savvy consumers of healthcare.
Next question, how do we get control over pharmaceutical costs?
Well, that is the $64 bazillion question as far as I'm concerned. I think the listeners, viewers, what you need to understand is the American public we are actually subsidizing. We are paying for the research and development that pharmaceutical companies go through, what they're doing. Other countries have made deals with pharmaceutical companies. They've really gotten pricing that is very favorable to those countries. And so the vast majority of future kind of development is based on what Americans are paying for their drugs. How we do that, price controls are not the answer, because what price controls will do is they will decrease the research and development, and we will not get these new life-saving, life-extending medications. I think, and this is a huge political sort of issue and battle, but I think what we need to do is go to these pharmaceutical companies, go to these other countries and say, you need to start paying your fair share. You have government-controlled healthcare in virtually every other country. Go to those governments and say, okay, you need to pick up some, just like we're trying to do with international defense, for example, and make these other countries pay their fair share. Now, what they're going to see, of course, is their cost for healthcare go up. But that will take the burden off the American public, and I think that may not be a practical solution, but I think that is an equitable solution and one that we should pursue.
Next question, how do we reduce costs when the CEOs for hospitals are making so much in salary? Should hospitals all become general hospitals?
Well, that's actually a good question, and it touches on several issues. If we go back before Medicare and Medicaid, if we go back pre-1965, basically what we saw in communities was we saw community-paid hospitals, county hospitals, who took care of low-income indigent individuals. And then if people had good health insurance or wanted to pay on their own, we had private hospitals to cover those individuals. Now, that may be a workable solution, a workable solution, and something that we perhaps should look into and pursue again. Making every hospital a government hospital is not the answer. And the reason for that is all we have to do is look at the VA, the Veterans Administration System in this country. That is a single-payer socialized system where all the employees are government employees. The hospitals are owned by the government, and everything is done with taxpayer money. There's a reason that VA hospitals exist. Believe me, and I strongly believe that we need to take care of our military and our former military, our veterans. But making every hospital in this country like a VA hospital is absolutely not the correct answer.
Way back in 1974, this is a question from viewer Ed. It says, way back in 74, I had a policy professor who said we were heading for a mess given the disconnect between a patient and the cost of healthcare. His analogy was you're greeted at the entrance of a grocery store by a concierge who says, come on in, all food is paid for, help yourself. And then we'd all go for the steak and lobster tail. This signals to drug companies and healthcare providers that it's okay to come up with multi-million-dollar treatments and cures. And once they come up with those, people demand that these expensive cures and treatments be available to them. Is that the core of why we need to get to third-party payers out of the way?
Yeah, that's a really good analogy. Actually, I use that in some of my presentations. It would be, I mean, our healthcare system, if we want to roll that over to our food delivery system, yeah, it would be like you're going to go into the grocery store and you're going to buy steak and lobster and crab and high-end vegetables and all of those things. You're going to get to the checkout counter and somebody else is going to write the check to pay for that. Now, that's nonsensical, but the professor in 1974 was absolutely correct. That is our healthcare system, and that is because of the third-party payer. Yeah.
Why do insurance companies get to determine what doctors I see and what treatments I get?
Well, that's mainly a cost-saving mechanism that they use. They do deals with providers, with doctors and hospitals, and they ratchet down what they're going to reimburse them. And so they develop these networks. And patients get caught out when they go to an in-network hospital, but they have out-of-network anesthesiologists or out-of-network ER docs or something like that. That's an issue that needs to be dealt with. But the reason that it happens is it's cost savings for the insurance companies.
Do you think the response to COVID-19 will end up simplifying healthcare policy in some ways?
Yeah, that's a great question, and the answer is I would love to see that happen. We looked at the state of Washington, for example, and there were emergency, if you will, emergency healthcare reforms that we thought were excellent. What I mean by that is greater use of telemedicine. There was some licensing relaxation considerations. A certificate of need kind of flew out the window because of the emergency. We would like to see those things continued. Now, they all happened because of executive orders, basically, from the Inslee administration. So we're hopeful that these kinds of things would persist. I'm not sure they will, but it potentially could be a major shift in healthcare reform.
Question for you. Do you think the state legislature will seriously contemplate or consider a single payer system?
Yeah, they already are, actually. What happened, well, probably for the last 5 or 6 or 7 legislative sessions, there's been a bill raised to look at state single payer system. Those bills have not gone anywhere. There was a bill, it wasn't exactly a compromise bill, but it was kind of watered down. It was a bill to establish an exploratory committee during the 2020 legislative session. That bill did not make it out of committee. But what happened was, in the budget, there was money set aside for this exploratory single-payer committee. So they actually have formed the committee. They've met several times. And again, they're going to potentially make recommendations back to the legislature for this next session. So, yeah, it's already happening in Washington State. I think what you need to understand, however, is that several states, Vermont, for example, which is a very progressive blue state, they got to the 11th hour. They actually passed legislation forming a single-payer system in the state of Vermont. They got to the 11th hour, realized that it was going to add 35% to their state budget, 35%, and they repealed the legislation. A couple of years ago, Colorado voters had the opportunity to pass a single-payer system. There was no funding mechanism. They couldn't figure out how to pay for it, so they voted it down. Even in California, probably one of the bluest states in the country, their legislature, which is heavily dominated by Democrats, their legislature cannot pass a single payer simply because they don't know how they're going to fund it. And so the same thing, Washington State is not unique. There is no funding mechanism that makes any amount of sense for a state to do it, and especially Washington State.
So far, the advocates are seeking headlines of support, but short of actual support or actual implementation. You know, it's like promising the kids they can have all the ice cream they can eat as long as they don't have to spend any money buying it. You know, it's kind of a excuse making. Next question: what's your opinion of the long-term tax? Do you know what that refers to?
I don't. I'm sorry. I don't know what the long-term tax.
If you submitted that question, you might want to clarify and elaborate and resubmit the question, if you would, please. Next question: is Washington State poised to mandate a COVID vaccine in 2021?
That's a great question, and the answer is I do not know. The vaccines, as I'm sure all the viewers are aware, the vaccines are being developed. We've got at least several in stage 2 out of 3 clinical trials. They're progressing along. Whether a state mandates it or not, I really don't know.
What's the best way, the single best way to reduce prescription drug costs right now?
Well, again, it goes back to having individual patients paying out of their pocket or via their own insurance plan to pay for these drugs. I mean, it's consumerism, right? It's competition in the marketplace. That's number one. The second thing would be to streamline drug qualification on the part of the federal government with the Food and Drug Administration, and to streamline drug processing so that these new drugs can be approved in a more timely fashion. As it stands now, from finding the first chemical that goes into a drug until they're actually available to the public, that's about a 10 to 12 to 15 year process. And then it kind of depends on what study you look at, but it's probably somewhere in the neighborhood of 1.5 to 2.53 billion dollars to bring a new drug to market. Now, a lot of that is because of the regulatory burden that pharmaceutical companies have to go through. So if we streamline that at the federal national level, and we put more competition into individual patients purchasing drugs, I think that would go a long way to solving the drug cost problem.
Next question, do the healthcare regulators believe that most people will not pay for preventative care, which means that by the time they enter the healthcare system, they'll have a serious problem? Then the viewer writes that they feel like these regulators believe people are too stupid to take care of themselves. What are your thoughts on that?
Well, yeah, the fundamental there is personal responsibility, I guess. Now, whether healthcare policymakers consider that or not, I actually don't think they do. I think they just say, well, the American public, people are who they are, and how are we going to provide healthcare for them? But at the end of the day, it really is a matter of personal responsibility. You know, whether we smoke or not, whether we do dangerous activities, whether we eat too much, things of that nature, whether we eat the correct things or not the incorrect things. That really comes back to personal responsibility. Now, you go to a single payer, you go to more government control, then it's kind of like it doesn't matter. You know, there's a backstop there. We have a government program that's going to take care of us regardless of how we live our lives. But to answer the question, I don't think policymakers take that into account, really.
With advances in genetic analysis, with so many commercial enterprises taking people's DNA and logging it, and with the likelihood of them finding connections, DNA connections to various diseases, some of which could be fatal and could be expensive, do you see a future in which people with certain genetic predispositions will end up in the high-risk pool or the pre-existing condition pools?
Yeah, I think so. And I think whether you think that's a good thing or a bad thing, I believe that's a reality. The corollary there is, of course, if you can identify a disease early on, oftentimes you can treat it, and you can make it easier for the patient to survive, live longer, and so forth without the disease manifestations. So, yeah, there's some good and bad news to this genetic sequencing and so forth, but I think overall it's probably going to be a good thing, and it's coming. There's not a whole lot we can do to stop it, so it's coming.
We got a clarification on the question. What is your opinion of the Long-Term Care Act, which will go into effect and take 3.8% out of the working people's paycheck? Long-term care for Medicare not eligible.
Yeah,
so it's a long-term care tax.
Yeah, right. Yeah, I understand the question now. Yeah, I think that's it's another government program, and no, I don't think that's the way we go. I mean, that's another step down the wrong path, if you will.
What should we be doing about long-term care? That's an interesting subject that's been brought up that we haven't discussed yet, which is, long-term care can be extremely expensive for higher quality long-term care, and people are living much longer than they used to. How do we deal with that challenge for an aging population?
Yeah, well, what's happened actually is the Medicaid has sort of taken over the long-term care. I mean, prior to 1965, there was a pretty robust insurance market for long-term care. Now, people didn't live as long as they're doing now, but that's another issue. What we need to do is actually, again, get the government out of this and revitalize that long-term care insurance industry, making those policies less expensive, encouraging people to buy them earlier, and then take them into retirement. I think part of the problem here with the entitlements that we have, Medicare and Medicaid specifically, Social Security too, but it's in the same boat, if you will. When Medicare and Medicaid passed, especially Medicare, when it passed in 1965, life expectancy for men and women, for men it was about 7 years less than it is now, and for women it was about 8 or 9 years less. And so what we're seeing over the last 55 years is an aging population, and to pay for Medicare today, I mean, we're having to pay for 7, 8, 9 years more of health care than was planned or budgeted for in 1965. So the issue of long-term care, if we're going to use Medicare as a safety net, somehow we have to increase the age of Medicare eligibility, for example, for future generations. And this kind of rolls into that whole issue of long-term care insurance. I think if we deregulate the insurance industry, if we get Medicaid out of this, I think the cost would come down for premiums, and more people would buy individual private plans rather than relying on the government through Medicaid.
Next question is, what would the cost impact be of eliminating the Super Drug Wholesale Company or companies between the consumer and the pharmaceutical companies?
Yeah, that would be substantial, actually. We spend a chapter in the book talking about drug and drug pricing, how pricing actually winds up at the end of the line in the pharmacy when the patient goes in and buys a prescription. And the questionnaire, or the person who asked the question is absolutely right. If we eliminated these pharmaceutical management companies, chances are excellent that drug pricing would come down. Now, they're very well funded. They have a lot of lobbyists, and they will claim that they are holding costs down for the average patient. The problem with these pharmaceutical benefit management companies is that the entire industry is it's very opaque, and you don't exactly know where the money's coming from, how much is going, how much they're earning, and so forth. It's very difficult to tell. But I can guarantee you, if we eliminated them, costs would come down for the average prescription for the average patient.
Next question, isn't part of the problem that we face right now with drug companies, isn't part of the problem the development process costing more than $1 billion to develop a single drug?
Yeah, absolutely. That's what we were just talking about. Yeah, it's anywhere from 1 billion up to 3-4 billion, again, depending on what research study you look at. And then the timeline is astronomical. I mean, 10 to 12 to 15 years. That's almost nonsensical.
Next question that everybody has is, how can I purchase this book, Healthcare Policy Simplified, Understanding a Complex Issue? You can purchase Dr. Stark's new book here. Just go to the Amazon link on the chat section of your screen. Right there, there's a link right there where you can purchase via Amazon Dr. Stark's book. Remember, if you have an organization and you'd like to have Dr. Stark speak to it about healthcare policy, email us so that we can schedule that with you, and Dr. Stark's happy to do another Zoom call. Dr. Stark, as always, I marvel at your expertise and your remarkable career, and it's just been a pleasure to talk with you. And I'm excited about your new book and the knowledge that it can impart to anyone who purchases it and shares it with others, and hopefully we'll take a lesson from it more broadly and maybe switch direction of the fork that we're facing here in this country. Thank you.
Great. Thanks so much, Dave.
You bet. And also, if you're watching, don't forget we have our annual dinner virtual event coming up on September 25th. That event is free. Donations are suggested, but of course it's free. Share that link with friends interested in the free market, and join us for our first ever combination East and West annual dinner combined for one statewide online event for Washington Policy Center. Special guest speakers, Victor Davis Hanson, the acclaimed author and historian, and former Congressman Trey Gowdy. Can't wait to see you for that. Also, stay tuned for more events. Just go to washingtonpolicy.org, go to the event section, and catch up on all upcoming events for Washington Policy, and subscribe to our newsletter as well to get regular updates for our policy and the events. Really easy every Friday. You'll have everything you need to know about Washington state policy right there. Thank you so much for joining us. We hope we'll see you again at our next Solution Series virtual event.